Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
The show will go on. Welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today we're broadcasting live from the Atlanta studios. As most of you know, we're supposed to be in sunny Orlando for the HIMSS 20 conference. But with that being canceled due to the coronavirus precautions, I could not be happier that we're still able to pull this show off. Many thanks to all of my guests that stuck with me and all of you to make this show happen today. Let's go ahead and kick off our virtual care strategy and innovation panel. So, Dr. Sylvan Waller, are you there?
Good afternoon. I am. Thank you, Justin. How are you?
Fantastic, my friend. Welcome to the show. Mikula, are you there? And Farhad Chowdhury?
Yeah, I'm here. Pleasure to be on.
Excellent.
Hey, Justin, I'm here as well. This is
excellent. Now, Matt, welcome to the show, my friend. So, Sylvan Waller, a local physician executive and virtual care expert and member of our health innovation think tank. Matt Mikula, global manager, healthcare solutions, Lenovo, and certainly member of our health innovation think tank. Farhad Chowdhury, CEO of Vianova Health and member of our health innovation think tank as well. And obviously, there's a great theme here from our think tank. And I did have my opening comments here. It's sad that it takes a pandemic to get us here and talking about this, but we did have this planned many, many months ago. But this momentum, I think we'll capitalize on this momentum at least. So I'm going to start this off. Real quick question over to you, Dr. Waller. Do a little bit of a level set. I mean, I think where do you see virtual care innovation evolving? Where do we see it today a little bit? But then certainly where do we see some evolution?
Yeah, thank you for the question. So, a couple of key data points as we talk about, level setting here. But when we talk about, where virtual care can provide value, Anthem recently did a study showing that millennials are at risk for having about a 40% higher disease burden than prior generations. And so if you think about that, part of that is, access to care, right? Still takes about a month to be able to see your family doctor in the U.S. Part of it is how they access other services. They're used to, using Uber, using, on-demand apps to be able to get all of their services. And so because healthcare isn't designed that way, it's not really created to, you don't really get to say like, oh, I want healthcare delivered on my terms. It creates a barrier to access for, a large generation born between 81 and 96. When you look at, again, an Accenture study that showed sort of, who has a PCP. So it was like 85% of baby boomers, 75% of Gen X, 65% of millennials, and then 55% of Gen Z. So when we think about, virtual care, the goal here is to be able to do things like reduce that potential disease burden on millennials that is going to be 40% higher than previous generations, and really deliver care on their terms. And so I think that the two things that are going on today are very timely, right? So one is coronavirus. This is really, it has the potential to be a significant driver for people to adopt more virtual care. Before, a lot of pundits, felt that people still wanted to do, see their doctor, go to a brick and office setting. Yep. And what we're seeing now is, a massive disruption of that because it's being forced on them. And CDC, came out and said, virtual care, telehealth should be the first sort of point of access in a situation like this. And so we can address the acute issues, but we have to be able to do it in a way that empowers the consumer and allows them to have care delivered on their terms. And that's really the second point that you and I have talked about before in terms of consumerism. But I think with the HHS interoperability and access rules that we were just talking about on the show before this, that is tremendously powerful to help consumers. Again, they have access and ownership of their data. They can then help, take control over how healthcare can be delivered to them. And there can be more engagement and more agency of those patient populations. And so I think those are just a couple of the things that, we're seeing virtual care, and particularly on the innovation side, evolving as it has been, and then will continue to evolve over the next couple of years.
I love it. So before we move on, I would like for you to cover, because you really have a great hands-on with patients too in the industry. What innovation, what does this mean for patients? What does virtual care mean for patients out there? Because I'm shifting my show significantly also onto the consumerism side of the world, then I really like to bring education to them. This is complex. This is complicated for them. It's there's a lot of fear at times, but I want to help people with, kind of get over some of these hurdles. But what does innovation mean for patients in healthcare?
Yeah. So in terms of, virtual care specifically, right, if we think about it, the doctor's office visit hasn't really evolved in 100 years. And this is just a really simple example. But virtual care now means we can use technology to break down a lot of those barriers to access. So it doesn't necessarily involve, scheduling to go in and see your doctor, which could be a month in advance. It doesn't mean, an episode of care, which is, the 7 or 8 minutes that a primary care gets with a patient these days. It doesn't mean building a visit around, what do we need to do to make sure that we're being able to satisfy, practice requirements here. It's really looking at the consumer and saying what's providing value to them on one end, and then what's providing value to the clinician on the other. And the goal is to connect those two and remove as many of those, traditional barriers to care as possible. And so virtual care can be, if you think about it, everything from chatbot on the front end, like, we're seeing a lot of companies introduced to be able to deal with their questions around coronavirus, using AI to be able to, determine sort of who's, high, medium, or low risk. Mm-hmm. It can be, instead of scheduling software, it can be, then interacting with a health coach or a physician to be able to answer some of their questions. And it can be, leveraging longitudinal care to say, we know what your past medical history is, we know what else is going on with you. We can incorporate things like social determinants of health into the care that we're providing. And it moves away from that concept of just an episode of care to now being able to deliver a much more longitudinal experience. And I think that's one of the key things that, how virtual care will continue to evolve is it'll move away from the idea of an episode towards much more of, an ongoing, constantly on ability to access care. And that doesn't mean it has to be high acuity, high intensity. But I think if we can provide consumers with answers to their questions that they have and guidance early on, we can prevent the complications of chronic disease that you were talking about just a moment ago.
Yep. No, that's terrific. I think 3, if not 4 of my guests brought up longitudinal care and how, this not only does new rule help create that, but that is an important key strategy. I mean, Dr. Halamka, Dr. DeSalvo, Don Rucker, all brought up, Anish brought up the importance, and actually Rasu. So I think almost every single one of my previous guests brought up the importance of a longitudinal care record for patients. And this is we're getting so far and fast away from episodic care and episodic records to really understanding the long term. And then that's when you get into a lot of the intelligence behind all of this as well. So I think you support that completely.
Yeah, and I think that's a key component, right? And as we talk about virtual care and innovation, it is the data and analytics. Now we say AI, but it was big data before, and sort of business analytics, before that. But even, in some of the think tank presentations that you and I have seen and participated in, the level of detail in terms of the data that we can capture and how we can make that actionable. I mean, I think I go back to a presentation we saw on social determinants of health, but that has a tremendous impact on these patients. And so now virtual care can be really relying heavily on data to provide actionable insights, and then ways that clinicians can help coach patients, provide earlier interventions for them. And I think the data is a key component here, and our ability to use machine learning and AI, those are buzzwords, they're really powerful in terms of what we can deliver to patients. And I think we'll continue to see the proliferation of that.
Excellent. And to be honest, I actually have your notes from that last think tank. They were phenomenal from our care strategy discussion. So I do recommend all my listeners to go to healthinnovationthinktank.com. And Dr. Waller does share a bunch of great insights. They're in Think Tank 6, but I actually have them up in front of me right this moment in case we have time to get to them, because they were phenomenal, and there's some great key learnings that you shared during that think tank. But maybe we'll get to a minute.
Thank you.
In a little bit. You got it, my friend. Matt Mikula from Lenovo. Well, from your perspective, what are some of the virtual care trends that you're seeing in the industry, my friend?
Yeah, I think it's very synergetic with the last statements that were just made. Fundamentally speaking, I think it's about making the technology easy, and that is both from the provider perspective as well as from the patient perspective. So consolidation of technologies If you talk to certain hospitals, you may have 4 or 5 or 6 different ways to do an e-visit. Having that be more fundamental and more platform-oriented in its approach, it's necessary, really necessary to drive into being able to operationalize it across businesses. Secondly, if you just look at assistance in terms of the treatments or the care plans that are being administered, doing that in a digital sense, making that easy for the patient. And from a provider perspective, allowing that to span more than a single treatment. So you don't have each treatment type having its own dedicated device with its own dedicated app, its own dedicated technology on the back end. And of course, each of those platforms having to be integrated with the EHR, sort of span off some of the earlier discussions. So from that perspective, making it easy to use. From a patient perspective, having it in a home environment, it's a lot about just education and being able to deliver education through the virtual platforms into the home environment where it can be more targeted to their condition, keep the patients off their web browsers and giving them relevant information specific to their care condition. So I think that's, from a Lenovo perspective, that's some of the things we think we can help with. And I think that's a lot of the going trends that we've been seeing.
Yeah, I completely agree. Certainly, the remote care, even Dr. Halamka brought up this morning, the home hospital, which I had not heard of that term before. But yeah, we're shifting care dramatically. We need to, as a country. We also need to make sure that our payment reforms and our payment models support that. That's something I think that's one of the big key pieces. I know that Rasu talked about that during his talk, is the need for us to keep our public policy evolving so we can support these type of infrastructures. And Anish brought it up as well. We've got to make sure that we have the right payment models in place to support this, because we can have all these great innovations. We know the need is there. Now we know the need is there even more greatly with what's going on today. But we've also got to make sure that we have the payments follow suit just to support this. And consumerism, I think that you guys are on the forefront of consumerism, and that's, as I mentioned a couple of times, near and dear to the show now. And even I think it's one of the great pieces about the interoperability rule yesterday is how consumerism, this really enables much more consumerism, patient access, and certainly interoperability with a lot of these app-based app devices and app-based devices. So, and certainly API-based interoperability.
About that, Justin, it's just also, you got to look at the logistics involved in, again, making this easy to use and span into the patient population. So once you start going after these treatment types and it involves bringing, say, kits into the home environment, a lot of logistics involved in both connectivity and the connectivity challenges that are there, but also in just pure distribution of the kits that would be needed in a patient's home, making that very easy to use, making that adaptable into the patient environment. What happens when the patient's done? How do you collect the kit and manage those logistics? Really, the care providers obviously want to be focused on providing the care. They don't want to necessarily delve into the logistical elements of this to make this sticky and have the broadest impact. So I think this becomes a little bit about the logistics and again, trying to make that seamless and as easy to use as possible.
Yeah, and you bring up a good point there. Remote care logistics is a term that you guys actually educated me on, and I love it and I appreciate it, and I know it's something key. So, I mean, just so for my audience, people who may not have had that on the forefront, can you give me 30 seconds on the importance of remote care logistics?
Well, sure. So as I mentioned, ultimately speaking, if you're a provider that's looking to get into the virtual care space and you want to go deeper with patients than just doing an e-visit, it becomes about that data collection that keeps being brought up. How do you get the data that would be relevant to their condition back into either the care environment or fundamentally into the EHR in itself? So that involves distribution and ensuring that you have something that's extremely easy to use, that's well tested, that works out of the box, that likely has a display that can work with the patient in a way that's meaningful to them. Could it be displaying patient education? Could it be remotely administrating, say, a digital care plan, prompting them with questions about how they feel, the diet that they're on, and sort of walking them through how to use the kit. So that pure delivery element of it is a big part of logistics that can be challenging for, say, some of the small software companies that are entering into the space. And then once the overall impacts start to occur, the habits are formed, the patients are then better at their care. We'd love to see the patients, continuing to use technology like this. But the reality is oftentimes that they move on, and then there is what to do next. That can involve collection of the biometric kits, refurbishment of the kits, redistribution to new patients, all the training and the overall overhead that comes along with that is a big part of the consideration in going deeper into the home environment.
It's fantastic. Thank you. No, it's something that's just not part of our vernacular today, and so I appreciate the education and the insight. Farhad, welcome back to the show, my friend.
Thank you. Pleasure to be here.
You guys got a great company. So first of all, I know about Vianova, but please give me 30 seconds, give the audience 30 seconds on Vianova Health.
So Vianova Health is, we've been around for 3 years. I would consider ourselves really a habit formation company. The entire team is certified by the Stanford Behavior Design Lab's founder, Dr. Fogg, in habit formation. I think we have the best science and IP related to habit formation, and Dr. Fogg even came on as an advisor of our organization. And we basically said we are obsessed with tiny, healthy habits and how do we, bring that about to people, and said, let's target, the most difficult demographic that's out there. Chronic disease patients who definitely really you could have the most impact on, and applied this methodology to that. And so we took our habit IP and applied it to a remote patient monitoring platform and said, let's go ahead and build an omni-channel approach to meet patients where they are. So as your Dr. Silver talked about, millennials are on their smartphones. The average millennial uses their phone about 6 hours a day. And, we have this, people keep talking about home care and, it's the last mile. If they say home is where the heart is, today we think home is where the smartphone is. And that's the truth with millennials. But at the same time, you got a great challenge of only 25% of seniors are on smartphones. So you can't have a smartphone solution. You really need a solution that uses the phone, but the phone is just not rich enough. It doesn't engage. It's not easy enough. And so we need to provide something that is the richest experience for telemedicine and monitoring. And we felt like, going back to our core principle, habit formation can only occur if it's simple. We got to make it super simple. And so we built, like we said, Vianova is a habit formation company that is now purely focused on remote patient monitoring for chronic disease patients. We work with the largest hospital systems in the country. And we've recently partnered with a great company that will help us do the distribution. It's called Lenovo. And so happy to, I hope I answered your question.
Yeah, no, it's great. And actually, I'll take a quick point here because I love my conversations with you. You've built a great company, but the habit formation, I just want to take a moment because I don't want to kind of gloss over that for my audience, because tiny, healthy habits is how I've recently lost 35 pounds. And I did it over a period of time, several years. I wouldn't stress about it. It was a minor goal. It wasn't like I needed to, but it was just getting in shape. I decided to, about 5 years ago, to begin a process to live a healthier life, eat healthier foods, exercise on a regular basis, moderate habits, all this kind of stuff. It's tiny. It was all tiny, healthy habits on a regular basis. Sometimes it's not even a daily basis. It's not about doing something dramatically one day, because you're probably going to not do that then again a week later. But if you have these tiny, healthy habits, it was a significant change in my life. I have more energy than ever. I'm at my ideal weight, and it came from tiny, healthy habits. So just from a psychology point, not even about technology. It's not about interoperability rules. It's not about virtual care. It's about what everybody can do in our earshot, to have a better life, a healthier life. Yeah. So what do you think of that?
I agree with you 100%. And I think you stated it beautifully. I think at the end of it, we get caught up with a lot of terms, but it is a psychology problem. And I would say that healthcare really is a habit formation issue. Mm-hmm. That's what we got to start shifting to. It's all about habits. We have to go from healthcare to health coaching, and coaching patients to better habits, which leads to better health. And that's literally our tagline: better habits, better health. That's the tagline of the company. That's the mission statement. And we think there's a definite mindset shift that has to happen for that to occur. And the fact that you state that is beautiful. But I just wanted to add, there's two ways to approach that. Mm-hmm. You can have an active engagement with patients, an app or a tool that alerts a patient, that's engaging them, that notifies them, that reminds them, kind of like what we built with Rosie. Rosie's our digital assistant to remind you, to follow up, to engage you. But we also are now moving into a trend of what's called digital phenotyping, which is the passive data that you have on a person's phone, how they sit, how they move. You can get their social index. You know how many friends a person has. If they're lonely, you can predict if they're depressed, anxious. And now with phenotyping, which is the passive data on your phone, you can even predict when someone's going to have stroke if a CHF patient is starting to use their left hand instead of their right hand. So we believe that you can use passive data and active data and combine those two to really develop and strengthen the tiny healthy habits that really bring about long-term change.
I love it. I love it. I kind of live and breathe part of that, but you guys take it to obviously a whole nother level with a lot of wisdom and innovation. So fantastic. So specifically, I know you covered some good points there, but what are some of the trends that you're seeing in the industry?
We're seeing, like I said, the trends that we see, kind of interesting, and I'll maybe be a little bit counterintuitive here, is telemedicine itself. As you know, as we've seen these deployments, it really is moving away from video calls and phone calls to chat. In some institutions, large hospital systems that we work with, they started telling us that 98% of the telemedicine engagement was chat. And so we've created, but the problem that I said before, 25% of your seniors, they're not using smartphones. Chat is not their forte. So we've created a very rich, simple engagement. It's almost like Alexa Live, visual Alexa with live interaction with the clinician. And we think that's the future of chatting with seniors and really just taking it to a whole other level. So I think that trend line is very key. The second one I kind of brought up already is phenotyping. You're going to hear this as the hot buzzword. I think HIMSS in 2 years will be like a talk about digital phenotyping. We work with some of the smartest people at Harvard right now, and we're working, and we have some really good technology. But basically, your phenotype is you can know a lot about a human being based on how they use their phone. And think about how many hours a day you're attached to your phone. I can even kind of assess people's personality types, beyond sleep and mood. And so the passive data on your phone tells you a lot about you. And there's this great quote. It's that your phenotype is the new genotype. Just like with genomics, we know so much about a person. I think we're going to know so much about a person based on just how they use their phone, where they are. That is really true AI and predictability, biomarkers for detection to, like I said, tiny health habit formation. And I think the last thing that you're starting to see as a real trend line is, you need sensors in the world of virtual care, and you're seeing a lot of devices coming out, but they're getting consolidated. One device that can do 5 readings instead of one device that just does 1 reading.
Yep.
And that's really the trend line going forward.
That's excellent. Yeah, and actually one of the terms that Dr. Holomka mentioned earlier today was wearables wisdom. I loved it. Wearables wisdom. I'm going to keep that one too. So that's awesome. I think just sticking with you, and then I'll bounce over to Matt after this. But thinking beyond today, what are some of the key strategies and trends? And you just covered certainly phenotyping that we must be ready to successfully navigate in 3 years from now, because we know what we're looking at. It's very complex, and I get that. But I also want to keep an eye towards the future. So what words of wisdom or nuggets of wisdom would you share there?
The last 2 kind of words of wisdom is, I really want healthcare to start moving into the thinking about habit. And like you said before, and I'll give you one simple one. I think we're seeing a massive trend line that shows the correlation between what I call is screen time and sit time. And if you look at the correlation between smartphone utilization and immobility amongst Americans and the obesity epidemic from 2007 to 2009, our unhealthy digital habits are impacting our actual health. And I don't think people are making that correlation. And so smartphone utilization, social media utilization, the depression and the anxiety, if a kid in middle school, a boy is on social media, 25% higher indication of suicide. A girl is 70% higher if they're starting to use social media when they're in middle school. We got to start looking at the correlation between our digital health and our digital world with our actual health. And so the last point that I wanted to make was to say back to that, for everybody that's under the age of 40, home is where the phone is. Home is where the smartphone is. And we really got to rethink a person based on that.
It's fantastic.
That's the trend line we're going for.
Excellent, Farhad. Appreciate those insights, my friend. So Matt, from your perspective, where should we be keeping an eye on 3 years from now?
Again, I just think it's about getting easy to use and having more adoption in the space that we're all here to talk about today. It's moving from the traditional care environments out into the home space. It's about seeing the impact. It's about finally bridging the gap between all the biometric data that's available to us and how we're going to consolidate that in a meaningful way that works for the caregivers. There's so many different enablers, so many different drivers that are motivating to push into the virtual care realm. I think it's going to become the reality now. It's going to be a lot of the discussions that have been taking place that, would have happened this year at HIMSS and it happened in previous years at HIMSS. Those things are going to start to come to fruition now.
Fantastic. I appreciate it. Excellent. I agree. Dr. Waller, what words of wisdom here, and certainly looking 3 years down the road, what should we keep our eye on?
Yeah, thank you. And I agree with Farhad. I think, I'm a fan of BJ's work, who's, the advisor that comes out of the Stanford Center. I think, again, the tiny habits and that focus helps people understand, to they have control over their health. And I think virtual care can do a better job of integrating some of that into the systems that we're building to be able to help give them positive feedback around some of these things. And I think, that's a key component of it. I agree as well. Right, in the work that I do today, working with a bunch of, venture-backed high-growth healthcare technology companies, that concept of digital phenotyping is a big push for many of them. And, again, being able to capture that data off of your smartphone, be able to determine, a lot of your behaviors has become incredibly better refined over the last couple of years. And I think we'll see a continued explosion in that area over the next few. And I still go back to, automation. And I think, Matt, you mentioned it, or Farhad, you did. But in terms of chat being a major modality,
Yes.
When I was at, one of the largest telemedicine companies in the country as CMO, 98% of our visits were video when I started there. And what we're seeing now is, a lot of, I do some work with health systems and hospitals, a lot of what they're looking at is that's a great modality, but we want to be able to capture a younger demographic. We want to be able to do chat and asynchronous visits with them or encounters with them or, longitudinal care with them. And so you do have to have a comprehensive solution, and it's, different choices for different folks. So millennials, are very comfortable with chat, but Farhad, as you said, older generations, still want, a more traditional experience, and they want to be able to talk to or see. And that's where, you do have to have a more robust product to be able to offer solutions to those stakeholders. So I think we'll see, continued focus on consumerism, continued focus on proliferation, of ways where we're delivering virtual care. I think we'll see, as you talked about, better and better consolidation of the biometrics, and not just biometrics, but home testing as well. And I think we're seeing that already today. So I think key themes we've all talked about, and we'll continue to see those, doubling down on many of those.
Excellent. I completely agree. Gentlemen, fantastic panel. You guys are awesome. You obviously are invigorating and give a lot of phenomenal thought leadership. I actually took copious notes here, and I love the content. Certainly phenotyping and habit formation. I completely agree. So love it. Gentlemen, as always, a pleasure. And thank you again to all of you listeners. Without you, we wouldn't have a show. So thank you for joining us today. And as always, you can tune into This Just In Radio weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. You can go to thisjustinradio.com or healthcarenowradio.com/thisjustin, and you can hear our show broadcast again daily. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you miss any of this broadcast or want to hear more, my shows are always posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Thanks, everyone. Have a terrific rest of your day.